Hey guys, Dr. Kerr shares a study here. Today I'm actually sharing a video.
Peter Barlis here, cardiologist. Now, I wanted to give you a brief update on a very common condition in the community.
This is professor and a cardiologist, Dr. Barlis. What he's doing is he's actually reviewing a study that was done in Atlanta.
And at that meeting, there's been a study presented
where it showed that the oral device is non-inferior to CPAP.
Now, they had a total of about 320 patients, and these patients all had a high risk of cardiovascular disease, at high cholesterol levels, high blood pressure readings, a past history of heart disease, stroke. Out of the 320 odd patients, there were 220 patients that on the sleep study had moderate to severe sleep apnea. Now, they then divided these two groups into treatment with CPAP therapy or using a mandibular advancement device. They then performed 24-hour blood pressure monitoring 6 months after treatment. There was a significant improvement in blood pressure control in those patients who were randomly assigned to using the mandibular splint device versus those who were treated with CPAP therapy. Now, there are a few questions as to why this was the case when we know CPAP is the first line.
And so what we're seeing, and this is something that we at Sleep Better Austin really know and believe, is that the people who have been diagnosed with sleep apnea oftentimes are only faced with one treatment option. That treatment option happens to be CPAP.
And I know personally many patients of mine who have been diagnosed with sleep apnea are unfortunately not able to tolerate CPAP treatment.
And there's a good reason for this. For the longest time, the oral devices just couldn't match up to the CPAP and the efficacy of the treatment itself.
Now, that is a major challenge. CPAP is the first line treatment. However, it can be difficult. Many of my patients say they can't sleep with it. They feel claustrophobic. They feel it delivers quite a lot of high pressure. And they, after giving it a good try for a few weeks, are unable to continue it.
And so what we found with this newer device, and specifically with this newer study, is that patients that go through mandibular advancement device have just as good outcomes as those that have CPAP.
So using a splint device was non-inferior to the traditional CPAP therapy.
In fact, they're even saying that it's non-inferior to CPAP for those of us that get diagnosed with obstructive sleep apnea. And so really, again, that just feeds the idea that if you're worried at the fact that you have sleep apnea and you're less likely to get moving forward with a diagnosis or even treatment because you're worried about having to do a CPAP, this study specifically tells us that you don't have to do the CPAP. In fact, what you can do is a mandibular advancement device, and we'll see just as good, if not greater, cardiac outcomes because you're much more likely to have the treatment, deal with the treatment, as opposed to using a CPAP, which a lot of us just can't tolerate. And so this is just an amazing rundown of what the newest study says. And again, the take-home message is the oral device is just as effective at treating sleep apnea and removing some of the symptoms, specifically high blood pressure, as the CPAP itself. And so if you have any questions about whether it be a diagnosis, if you know anybody that needs some degree of help when it comes to sleeping soundly, and sleeping throughout the night, and they're scared about using CPAP, please let us know. We're here for you, and we can make your life better, help you sleep longer and live longer.